This is Dr. Hannush from the Cornea Service at Wills Eye Hospital. I'm actually coming to you from the locker room in the OR. And today I just finished doing a nice deep anterior lamellar keratoplasty on a 35-year-old gentleman who had had an intact ring segment placed for keratoconus. It gave him good vision for many years. The ectasia continued and eventually he could not see anymore, so we decided to do a DALK procedure, deep anterior lamellar keratoplasty. What you'll see me doing is starting out with a partial thickness trephination, usually 250 microns. I will then use a cannula. I use a cannula made by Professor Sarnicola from Italy called the Sarnicola cannula to inject air into the posterior stroma and create what is known as the big bubble. The big bubble usually extends about 8 to 8.5 millimeters. After that, I will do a paracentesis, and I'll put a little air in the anterior chamber, which should be peripheralized by the big bubble if you have a good big bubble, in this case, a big bubble type 1. I will then debulk the anterior lamella, the 300 microns. This is followed by what we call the brave slash, where the knife goes into the big bubble but does not lacerate Descemet's membrane. You will see me then removing the posterior lamellae in 4 quadrants and leaving just a layer of Descemet's membrane and endothelium. Attention is then given to the donor tissue. I will strip Descemet's membrane and endothelium off the donor after I've stained it with trypan blue and bring it over to the recipient and suture it into position using the technique of choice, in this case 8 interrupted and a 16 bite running suture to end the procedure and rehabilitate the vision of this keratoconic patient. Again, Sadeer Hannush coming to you from the locker room in the OR at Wills Eye Hospital in Philadelphia. Thank you for your attention.